Smoking is a perfect example of what I think is the fatal flaw of the movie rating system, which is that it's about public acceptability, not about how it affects us and influences us. Um, there is a movement among public health leaders and among health associations like the American Academy of Pediatrics to get smoking in a movie automatically require an R rating, as well as a number of disclaimers that they didn't take any money for product placement, etc. Um, and the thought behind that is if an R rating is, you shouldn't go in without an accompanying adult if you're under 17, and if cigarettes aren't available for sale until 18, that you are hopefully limiting what research has shown to be the strongest single marketing tool for new initiation of smoking. Research has shown that the single most powerful motivator for young people to start smoking now is seeing attractive favorite stars in movies lighting up cigarettes. Because we have done a really good job in decreasing, even eliminating a lot of advertising and marketing for cigarettes in children's media or children's accessed venues. Seeing Julia Roberts or Brad Pitt light up a cigarette is hugely powerful to the 11 to 15-year-olds who are most vulnerable for starting to smoke cigarettes. Historically, the entertainment business, whether it be music or movies or television, has used popularity and sales as their metrics for success. How many records have you sold? How many tickets have you sold to this movie? And what we have learned from the science is that media are not only ubiquitous and pervasive in our lives, but immensely powerful in shaping the way we see the world, the way we understand the world, and the way we behave in the world. As such, they are very powerful health influences for good or for bad. So smoking is a good example of something that instead of just saying, well, I think, Brad Pitt smoking this cigarette will sell more tickets and therefore is a success, they need to take some social responsibility into account and say, if we have a choice of putting a cigarette in Brad Pitt's mouth or not, how many kids are going to start smoking because of it? It is estimated that motion picture influences are responsible for about 390,000 new smokers every year, which is not bad considering 440,000 die every year. So they're almost breaking even in terms of their market. But we need to ask the entertainment industry to be responsible, just as we have asked the automotive industry to be responsible with airbags and safety belts and car seats. I think we as a society can ask of our entertainment that it not hurt us. What we have found is that in the space of 11 years, they shift one ratings point. In other words, what was an R rating 11 years ago is a PG-13 now. Exactly the same content. And that's because social values shift. What doesn't shift is health risk. What doesn't shift is the way human brains develop and the way human bodies respond to various types of stimuli. So I think that we should use the science that we now have at the Center on Media and Child Health and other places to guide a whole new rating system, which, like the nutrition that you can read on the side of a food package, and learn what you are sending or what you are putting into your child's body, we should have that level of science applied to what we're putting into our children's minds.